It's been 2 years since people could sign up for health care insurance under the Affordable Care Act, called Obamacare by many. 27 First News reporter Jerry Ricciuti found out how the law has impacted local residents, physicians, and hospitals.
Over the last couple years, those watching over implementation of the Affordable Care Act admit there have been struggles.
Like anything, there's bugs and they need to work through them. And so that's kind of what they've been doing.
Still, figures from 2014, the most recent available locally, show more than 800 people have been enrolled in the system in Mahoning and Trumbull counties, many of them coming from the inner cities.
There are pockets that we are having a difficult time getting into in the rural community.
Health officials claim the numbers of under or uninsured in the two counties has dropped by about 45%. Hospital administrators tell me they're seeing the difference as well.
The number of uninsured patients has gone down, but what we have seen is an increase in the Medicaid.
Mercy Health CFO Matt Love says the increase in patients with health care coverage has also led to greater access to local services, including more visits to local emergency rooms, physicians' offices, and hospital admissions over the last 18 months. But at least one local doctor argues success isn't quite that simple.
It's not just are they insured, it's are they insurable or are they able to afford insurance.
Sean McGrath is the past president of the Mahoning County Medical Society. He tells me while the ACA has provided coverage for some, it's actually hurting others.
It's still that working middle class. They're still getting killed. I don't see where that's really changed.
McGrath claims the real winners have been the insurance companies, while patients have seen their premiums and deductibles skyrocket.
The people who need it the most still are paying the most when they probably can't afford to be paying that much.
But others argue outcomes for patients who have been enrolled are much better than when they had no insurance.
They just stayed away from the doctors. When they were sick, they tried to get over it. So sometimes it would, put them 3 weeks to heal from a cold, when now it's taken them a couple of days because they're able to go to the doctors.
As for the future, Bishop says state health officials are still struggling to process new Medicaid enrollees. More than 500,000 people were added to the system the last year and a half in Ohio, 100,000 more than expected. In the meantime, McGrath worries more and more doctors will retire or simply stop taking Medicaid patients, while consumers will still have trouble finding affordable insurance.
I don't like where I see it going right now.
But he also does not see the law many call Obamacare ever being repealed. Jerry Ricciuti, WKBN 27 First News.